This Sun-Gazette video coverage is proudly sponsored by Woodlands Bank.
Okay, well, thanks for talking to us today. I appreciate it. I guess we'll start with, you've been in healthcare now for 38 years. Where does your love for working in healthcare stem from?
Well, 38 years has come and gone very quickly, I will say that. Really, when I was in college, I wasn't sure what I wanted to do. So I joined the Army National Guard after college, came back to the Williamsport area after I finished my basic and advanced training. And John Baylog offered me a job at the Lycoming County Nursing Home. I went there as the assistant administrator and fell in love with healthcare, and I've been in it ever since.
The health system has seen a lot of changes under your leadership. Which ones stick out to you as the most impactful for our community?
Wow, there's so many different things that have happened. That's hard to pick any couple out. But two or three that come to mind as I think being certainly among the most impactful. The first was the decision to keep Divine Providence and Williamsport Hospital in the city of Williamsport proper. At one point we were considering relocating them outside of Williamsport in the east part of Lycoming County. So that certainly is one decision, to have remained here and then to invest in the properties and in the people in this immediate community is certainly a big one. Secondly, I think a decision and a commitment to retool the regional emergency rooms that are part of the health system into a trauma system. That has been an extraordinary impact. I mean, there are people alive today because of our commitment to upgrade the overall performance of our emergency rooms to a trauma system that wouldn't have been alive in years prior. And then the third certainly is the commitment to UPMC and to becoming part of that organization. That will continue to impact our community for the foreseeable future.
Okay. Have you had any mentors? Have you helped you along your way from Lycoming College to present day?
Mentors. Mentors are an interesting thing. Some people have like one or two mentors they spend a lifetime with. For me personally, it's been mentors at different points in my life, kind of the right people at the right time, which has really been a blessing for me. I mentioned John Baylog earlier. He was one of my earliest mentors. A colonel by the name of Frank Brown was an important mentor. Creighton Hale was a mentor during my leadership Lycoming days. Don Kramer was a CEO here in the 80s. He was an early career mentor. And then, other people that I had the blessing of being around and having been supported by, people like Marv Stamen, for example, or Dick DeWald. So just the right people at the right time over a career.
Okay. Tell me about some of the most rewarding parts of working in healthcare.
Well, for me, working in healthcare is an extension of growing up as a young man as part of a family of pastors. And so healthcare is a helping profession, an extension of a helping profession. And so, one of the joys and blessings that I think I receive from this is that I get to do something I love to do. It's very demanding. It's intellectually stimulating. Working with great people, our medical staff, our nursing staff, our administrative team, an extraordinary community, a wonderful part of the country, and be able to use my business skills to do good things for the community.
What's the most challenging part? The last 2 years have been very challenging. What sticks out in your mind as being the most challenging thing you've gotten through as a team?
Well, there are constant challenges. One, there's a huge change in our industry moving from an inpatient-focused service, if you will, to an outpatient-focused service. That sounds like it might be a relatively easy transition, but these buildings were all built for inpatient services. and transitioning them to outpatient services is a very, very expensive proposition. And in some cases means that we have buildings, maybe entire hospitals, that we don't need anymore. And appropriately dealing with those is very, very challenging. Technology obsolescence is another one. So technology in healthcare has a lifespan of approximately 7.5 or 8 years. And that's not when the equipment wears out. We're talking about $1 million pieces of equipment. They don't wear out in 7 or 8 years. They become antiquated and obsolete for technical reasons. And so constantly maintaining state-of-the-art equipment is another very big challenge for us. Right now, today, I also think that the changing dynamics and regulations and rules dealing with Medicare and Medicaid, which is about 65% of our business. I mean, every year major changes occur in those areas. Today, right now, as we speak, the biggest challenges we're facing is staffing, having enough staff in all of our key areas. The baby boomers are retiring. The new generation of nurses and doctors has many, many opportunities, and in some cases are choosing careers outside of healthcare, even though they'll be using their technical skills, and those options weren't available in the past. So we compete with all of that to make sure we have enough doctors and nurses for services right here in the hospital. So huge, huge challenge, and will be so, I think, for the coming 5 or 10 years.
Okay. You're a pretty familiar face in our area, community events and initiatives and different organizations. Why do you feel it's important to give back to our community?
Well, you know, we all stand on the shoulders of those who've gone before us. And that's true of individuals, it's true of communities. And so in order to assure that our future generations have the benefit of a beautiful environment to live in like we have here, and a solid, successful community to support our lifestyles, we have to invest in that. So it takes time and energy from all of us, and I'm just doing my part.
So what's next for you?
Well, retirement is a word used right around this point in most people's careers. That one's a little bigger pill for me to swallow personally. So I like to say that I'm proceeding to the next adventure. So I have accepted a position as the co-CEO for a brand new 500-bed hospital being built in Chengdu, China. And I've started some of the preliminary prep work for that. The building itself will be done in the spring of 2023. And my dyad partner and I will be responsible for opening it and running it.
Will you be based in Williamsport or China, or a combination of the two?
Well, right now we have very limited travel ability to China. And so the people who are in the country working on the building, for example, are doing just that. And those of us who are based in the United States right now are all working together, but we're working remotely. It's about a 12-hour time difference, so it's a bit of a challenge. We're getting a lot of work done, but there'll be a lot to be completed yet when we finally can travel. I'll be traveling to China for the opening and remaining for some period in time until things smooth out, and then I'll be returning to the States, and my dyad partner will be remaining on site as the permanent, if you will, CEO for the hospital.
If you could tell yourself as an undergrad at Lycoming Colleges that you would be president of a health system someday, what would your reaction be?
Gosh, I wouldn't have thought this, to be honest with you. When I was in college, I still thought that I was going to be an attorney, maybe an architect, but I certainly hadn't decided yet where I was going to land. But through, I don't know, a system, or rather an experience I guess I would best call a calling. I landed in healthcare and have been thrilled with the experience and been blessed by it every day.
What would you like to say to the community as part of this transition in the health system's regional leadership under Patty Jackson-Garris?
So Patty Jackson will be the new president of the regional health system here, part of the UPMC family. She'll also be the president of the Williamsport Hospital. She is an enormously bright and gifted leader. She brings a communication and marketing and strategic planning background to her work here. She and her team, the medical staff leadership, the administrative leadership, the nursing leadership, will do an outstanding job. They'll do things differently, certainly, than I've done them in the past, as they should. But one thing is certainly clear, and that is the mission and the vision and the values of the organization, and our commitment to always doing the right things for our patients no matter what will be something that she and her team will certainly demonstrate in the years to come.
Is there anything I didn't ask you about your time in Williamsport that you would like people to know?
Well, when I finished college here, I came here from New Jersey to go to Lycoming College. I expected to be here 4 or 5 years and then moved on. So I'm really surprised to see myself, to look at myself in the mirror and see myself still here. I will tell you, I married a lovely young woman 40 plus years ago now who expected me to take her out of town. And here we are, still in town, raised a family. They've moved away, we're still here. But it's just been a terrific experience, and I can't think of a better place to live and better people to be around than those right here in North Central Pennsylvania.
Great. Congratulations on your retirement, and thank you for sitting down with us today.
Thank you. Certainly my pleasure.